The measles outbreak in South Carolina was the largest in modern American history. I sat down with the executive director of the Southern Alliance for Public Health Leadership to talk about what it took to contain it, why staying engaged after the crisis ends matters, and how public health professionals can advocate right where they live. You're listening to the PHEC podcast, episode 466. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, epidemiologist, entrepreneur, author, and your host every Tuesday since 2017. I've spent over 2 decades working at the intersection of health, community, and meaningful change. My book, The Public Health Consultant, Expertise, Entrepreneurship, Greater Impact, publishes December 2026 with Johns Hopkins University Press. Outside of this podcast, I lead Dr. C.H. Huntley, LLC, partnering with large nonprofits, government agency, and tribal nations on strategic planning and implementation. Lately, much of our work has centered around workforce development, helping organizations build the capacity they need to serve their communities well. That work and this podcast are driven by the same passion, helping public health professionals and the organizations they lead create real change in communities they serve. Let's dive in. I'm excited to introduce you to my guest on this episode, the executive director of the Southern Alliance for Public Health Leadership, works across 5 southern states to protect public health, educate the public and policymakers, and build the kind of community coordination that holds even when crisis hits. In this episode, we dig into the South Carolina measles outbreak, what actually happened to contain it, and the ongoing challenges around vaccination access and trust in the community there. We also talk about navigating a contentious legislative session, why coalitions matter more than ever, and how public health professionals can show up as advocates in their own communities. At the end of today's episode, I'll tell you how you can find an exclusive follow-up conversation with my guest that lives inside of our private community. Let me introduce him to you, and then I'll connect our conversation. Scott Thorpe is a longtime public health advocate and executive director of the Southern Alliance for Public Health Leadership. Previously, he served as a longtime clinic operations director and health director in the Midlands region at PHEC in South Carolina, and was the Public Health Infrastructure Director at Georgia Department of Public Health. Let's connect my conversation with Scott right now. Hi, Scott. Welcome to the podcast. How are you?
Doing all right. How are you?
I'm good. Looking forward to our conversation, getting to know you a little bit better and doing a deep dive into a few questions. I met you at the South Carolina Public Health Association's conference. Well, at the time of this recording, it was a few months back. So I knew then, invited you to be on the podcast then. It took us a little while logistically to get it organized and set up. So I'm really happy to be at this point. Why don't you just take a moment, introduce yourself, tell everyone a little bit about what you do?
Yeah, so I am the executive director at the Southern Alliance for Public Health Leadership. We protect, improve, support public health across the South in Alabama, Tennessee, North Carolina, South Carolina, and Georgia.
I have to visualize that. I was trying to think because that is really wonderful. Now, when leadership is in the name, so is it focused on the public health leaders across those states specifically?
Yeah, I would say we interpret that pretty liberally. And I think part of what we also try to do is cultivate leaders, right? And I actually think in some ways, one of our big problems in public health right now is that we have too few leaders in the South. We have so few spokespeople. We have so few voices that part of our work is also sort of growing the diversity of voices in public health across the South and creating new leaders.
Gotcha. Thank you for that deeper explanation. We're gonna dive in a little bit more in a minute to what you're doing now, but I often like to go back and learn about the journey to this point. When did you first learn about or become interested in public health? Do you remember that point in time? Love you to share about that.
Yeah, absolutely. So my first career was in politics. I ran campaigns, moved all over the country and mostly in the South and ran campaigns. And I was working for a legislator in Virginia at one point, and he said, if you really want to impact policy, you need to go to grad school and you need to actually get more involved in the actual policy process. And didn't really know that I was interested in public health and went to Johns Hopkins and actually sort of fell into an internship at the Baltimore City Health Department. And I just fell in love with it, just blew me away. And I knew after like 3 months, I was like, I'm going to do this for the rest of my life. And so ended up working at the Baltimore City Health Department and several other public health organizations in the city of Baltimore for a while before moving to Columbia and working in the Midlands region there. And I've done a lot of different things in public health over the years, but just absolutely loved every second of it.
That's awesome. I love that story because sometimes you have to be in it to really understand what it is and to get bitten by the bug, so to speak. So that's a wonderful segue. Path, journey, really all of your background, none of it goes to waste because all of that's very relevant and very important to this
Yeah.
policy work and in public health especially. Is there a particular population or issue or condition that you're most passionate about right now?
Yeah. I think this is probably a slightly broader category, but just how families access healthcare and how kids and their parents interact with public health and healthcare. We talk about growing hesitance around families wanting to vaccinate their kids and that kind of thing. But we also have some really serious challenges around how people access our healthcare system. And when I grew up, it was just kind of an assumption that every kid had a primary care provider, that every kid was going for their well visits. And that isn't realistic in the world today. Something like only 60% of kids across the South are actually hitting those well visits every year, which means they're missing out on healthcare that really they need. And so that's something we focus a lot on. It's also something that certainly keeps me up at night. Think about all the downstream consequences of our families sort of unplugging from the healthcare system. It's not good.
Yeah, I think that is a perfect segue into something I wanted to ask you about anyway, and that is here in South Carolina, it's hit the news, so I know people are familiar with the measles outbreak. So, the time of this recording, this is mid-year, so we're early June 2026, but hit headlines. I think you and I even talked about it when we were at the South Carolina Public Health Association's conference, and I was like, "I really want to discuss that." And since then, I know that, I've seen updates that say it's been contained, so forth. But can we talk about the outbreak? Because I think that's really related to maybe even this concern, access to healthcare and or how families and children are accessing the systems. Yeah, let's just jump in there about this outbreak.
Yeah. So the Southern Alliance for Public Health Leadership has two arms to it. One is focused on educating the public and policymakers about public health topics, like, for example, why vaccines are important, why measles is bad. But the other arm is really focused more on coordination. So when we have good policy on the books, how do we make sure that the constellation of partners working around that policy do a good job at working together? And in the case of school vaccine requirements, for example, the challenge is often how do ed sector folks or principals, superintendents, school nurses, how do they work with public health, healthcare, nonprofits, all of those different pieces to make sure that everybody works together, make sure kids meet the school vaccine requirements and that parents have the information they need. And so early last year, we set up a local group to start looking at ways to improve coordination in Spartanburg. And this was actually before the measles outbreak had started. And the reason we chose Spartanburg was because we knew Spartanburg had low vaccination rates compared to the rest of the state. And then the measles outbreak started, and it is contained now. That was the largest measles outbreak in modern American history. It was a really big deal. And honestly, I think we'll be dealing with some of the consequences of that outbreak for a long time. The issues around low vaccination rates in Spartanburg also is not resolved, right? We do know a lot of additional folks likely got vaccinated because they were specifically concerned in the context of the outbreak, but not enough to fully cancel this issue out. So our local coordination group really focused on how can we bring all of these partners together to better inform the community and provide resources in the community, both to address some of these access issues and to address some of these concerns that community members might have about getting vaccinated. Spartanburg is unique because they have this pretty significant Slavic community of Ukrainian and Russian folks who have a very low vaccination rate. And it doesn't really track along the same political guidelines that you might think for what's happening more broadly across the US right now. But it is a real challenge and has been a real challenge there for decades. So I think one of the things that we've tried to focus on is how do we better reach that community? How do we build relationships in that community? And I think one of the most important parts is that now that the outbreak is over, we're not going away. Because I actually think that's one of the big problems oftentimes in public health is that folks walk away when the crisis is over. And so we're really focused on trying to stay there and continue to build relationships in that community.
That's great. I'm really glad to hear that. It's really important what you just said about continuing to be present and continuing the relationship. It's an example that we've often used and I speak about all the time. When the funding is there for whatever the program or the intervention, we show up. And then when that dries up, we move away. And the people that are doing the work care, but when they have to follow that trail, and it's not sustainable. It's not how we build real relationships with anyone, but particularly when there's already an issue of trust and then we show up and then back away, that doesn't help resolve that underlying issue of trust or really help to build relationships that will then lead to better outcomes down the road beyond measles. What do you think helped contain the issue, resolve the outbreak?
That's a really good question. Some of it, honestly, is luck. I hate to say that, but I think that's some of what it comes down to. I also think in many cases, these outbreaks eventually burn themselves out.
Mm-hmm.
But I do think while there is a community of folks who were not willing to get vaccinated or to get their kids vaccinated, for the most part, people were actually pretty good about following directions around isolation and quarantine. So I think that was helpful. That certainly helps contain the outbreak. I think one of the challenges, though, is that, I said this population may be unique. The vaccination rates in Spartanburg are not. If we look at other communities across the South, Spartanburg's not really an outlier. And so it seems almost likely that we'll continue to see these big outbreaks start to pop up. And actually, the day the Spartanburg outbreak was declared over, there were a couple of new cases reported in Saluda. And they had nothing to do with the Spartanburg outbreak. Now, it's not going to turn into what we saw in Spartanburg because Saluda is much smaller. But, we're going to continue to see these cases pop off. And we're just going to see this sort of rolling boil of measles cases across the South unless we can increase our vaccination rates.
Well, thank you for sharing about that. I think perhaps we can continue that to stay in touch, and maybe I could be a resource as we all put our heads together across, what we can do in the South. We have so many, keep volunteering to all these causes, but we have so many problems that really need attention across the South specifically. And I think it's important as we continue to put our heads together and talk about things and figure out creative even innovative ways to approach some of these older problems.
Yeah. Well, and just going back to where this conversation started, yes, some of this is about reluctance and hesitancy to get folks vaccinated, but that's not the only issue. Access is really a real challenge for a lot of folks. If you look at where the Slavic community in Spartanburg is concentrated and look at what it would take to get to the nearest primary care provider using public transportation, it is not easy or short. And then you throw in, someone having multiple kids with them, having to manage their work schedule. All of the challenges that we're all familiar with. It's really challenging for people to get access to the services they need.
I think our whole state is a rural state. We've got we've got different levels of rural, but got a lot of challenges that are underlying all of these conditions that definitely need, I think, some fresh conversation, fresh perspectives. But let's talk a little bit more about the other side of your organization and focus. Can you dive in a little bit more about that?
So, in the midst of this outbreak, we also had a very busy legislative session where there were simultaneously lots of bills to either dismantle school vaccine requirements or get at limiting vaccines in some way. And as an organization, we don't just focus on vaccines, but just given the outbreak and given the number of bills, it dominated a lot of our work in South Carolina this year. And I don't know quite how to describe it or the reason behind it, but a lot of those bills were coming from the Spartanburg legislative delegation. So we spend a lot of our time trying to educate lawmakers on why vaccines are important, the costs of an outbreak like the one we saw in Spartanburg, understanding what vaccination rates look like. There were individual schools in Spartanburg that had like a 20% vaccination rate, and understanding the risks that creates for that student body is really important for everybody involved. And if you're a lawmaker thinking about voting for a bill that would limit vaccine access in some way, you got to understand what those risks are and what that could do in communities. So that occupied a lot of our work this year. And luckily, we did get through session in South Carolina this year without any bills passing that really did any real damage to vaccine access in the state.
Well, that's encouraging to hear. We've had I don't know that it's because I'm paying closer attention or if it's truly been the most active, interesting year politically here in South Carolina. But it feels like it has been. I don't know. I've been here for over 20 years and I don't remember a year where it's been this interesting and certainly frustrating.
Mhm.
That's the best word I can come up with. The most bizarre things are popping up, and I thought those blue laws that were hot topic when I first moved here was bizarre, but this year has been really, really a lot of really twists and turns that I just didn't expect.
Well, I think one of the reasons why there's a need for an organization like ours and why we do the work we do is because sort of institutional public health is really struggling to figure out how to respond in this bizarre situation. I think what public health likes to do is to be just the facts, right? Like to just present what they know are the facts and count on everybody to make the best decision they can. I think the legislators and a significant chunk of the community in South Carolina has a somewhat hostile view of public health right now as a profession and as like a governmental institution. And public health is, in particular, DPH, is not really able to fend itself as a cabinet agency. And I mentioned before, part of our role is about creating new leaders and creating a diversity of voices in public health. And I think part of the reason and the need for something like that is when the only people who can be out there talking about and defending public health are the 3 or 4 people from a state agency that legislators strongly dislike. It's really hard to prevent all these bad things from happening to public health. And so I think that's a little bit of the gap that we can fill. Along, honestly, with the South Carolina Public Health Association, I think they can play an important role in this too.
That makes a lot of sense. We had some really good people present at the annual meeting, and everyone seems to have like a renewed energy, which was also refreshing to see. So a lot of organizations, along with some new leadership with South Carolina Public Health Association. So those are all things that are, like I said, refreshing. As executive director, what are your primary responsibilities in your current role?
Well, that's the joy of being in a small nonprofit is it's all of them. I have all the responsibilities.
Right.
We have one additional staff person who's in Asheville, who's our advocacy director, and he manages a lot of our Tennessee and North Carolina work. And we have a couple of interns and an evaluator, but day to day, I'm managing a little bit of everything. That for a small nonprofit, that also means I spend a lot of time doing fundraising. So working on grants and working to also collect individual donations. I think one of the kind of neat things about our organization is we push really hard to try to raise funds through individual contributions so that we can have the flexibility to really respond and we're not driven by grant cycles. When we feel like there's a need for us to really dive in and work on something, we can do it and we can do it quickly. I also think a lot of our work is very coalition driven. We have a state level coalition in each of these states and then local coalitions in 5 or 6 different places. And I think the value in that approach is that we can all play off each other. So there are times when, for example, it's really helpful for us to be working really closely with state agencies. There are other times where it's actually kind of valuable for them and for us to have a slightly more confrontational relationship, to be the ones pushing for change on a specific topic when maybe they can't. So that sort of coalition approach lets us sort of plug and play to the issues as we need. And I think there's a lot of value in that. And again, it's a way to sort of create a diversity of voices around these issues. And I think particularly right now, a lot of folks in public health feel very isolated and maybe working in a silo. And this is a way to sort of bring folks together and connect and collaborate and realize that you're not doing this work on your own.
I like that. Definitely a rise in coalitions. I think I have a newfound, I'm really fond of them actually in the last year or so, especially. So there's a lot of power in having coalitions. So they do fill a gap. And I like everything you're describing, sort of diversifying the funding so that you're not, you're more flexible and nimble. That's important and important part of sustainability in the times we're living in right now, especially. I'm enjoying our conversation, but I also want to be mindful of time. So I think I'm going to ask you one more question. We have a very diverse audience of listeners to the podcast. So you and I have talked very specifically about South Carolina. This is where we live. I think it's very relatable to other states. So I think people can hear what we're saying and really, take something from that to where they are. But we've got a mixture of students, professionals of all levels, and maybe even some consultants that listen, government folks. But is there any bit of advice that you would share with someone who's listening to this conversation that would encourage them during these challenging times in public health?
Yeah, I think where I get hope and where I think other people can find hope is in their immediate community. I think where often as public health professionals, we tend to be interlopers. We tend to be folks who show up to work around a specific issue often in somebody else's community. And that doesn't always feel great. And I think because of that, we often lose sight of the kind of credibility we have within our own communities, whether it be around public health or something else. And the reason I say that is as people think about like advocacy and talking to legislators, they don't want to hear from Scott Thorpe. They want to hear from their constituents. And so think about reaching out to your legislators. Think about reaching out to your school board members. Think about your county council folks, because they will respond to you because you're their constituent and you have credibility both as a constituent and as a public health professional that is really important, or a public health student or consultant or whatever your role might be. And I just really encourage folks to think about these issues in the context of their immediate community, because that's where a lot of this change starts.
That's very important. Thank you so much, Scott. This has been a fantastic conversation. I appreciate you showing up every day for South Carolina and the South here and all that you do. Thank you for coming on the podcast and sharing with us.
Yeah, absolutely. Happy to be here.
If you are a member of the PHEC podcast community, then log in and head straight to the episode activation lab. That's where there's an exclusive follow-up conversation with Scott that's waiting for you. Now, I really hope you enjoyed that conversation as much as we did. This conversation is a reminder that public health happens at the local level, and the relationships we build at this local level are what carry us through a crisis. Staying present after the cameras leave, diversifying your coalition's funding and voices, and engaging your own legislators as a constituent, not just a professional, are strategies that translate no matter where you work or what the issue is that you're facing. Change starts close to home, and you have more credibility in your own community than you might think. I hope this episode encouraged you to use that. I encourage you to connect with Scott and learn more about the work that he's doing across the Southeast. You can find the links to connect with him on the show notes page. The show notes page for this episode, which is episode 466, can be found at phecpodcast.com. Once you're there, just navigate to episode 466 to find the show notes. After we stopped recording, I asked Scott one more question, and the answer is waiting for you inside the PHEC podcast community in our episode activation lab. You'll find it in a post titled After the Mic. Now remember, our podcast has an app and a private community that's independent of social media platforms where you can engage with public health professionals around the world. In addition to being part of this amazing community, your membership supports the production of this podcast and episodes like this one. You can download the PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcast.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.